Good morning, everyone, and welcome to our webinar, COVID-19, Separating Fact from Fiction and an Integrative Approach to Your Health. I'd like to introduce you to your presenters today. First, we have Dr. Orit Holtzman. Orit is a beautiful mother of three, a functional medicine doctor and a cannabis clinician. She founded a longevity lab, which is in Katoomba, in 2018, and she joined the Compass Lifestyle Clinic in May 2019. She holds a Bachelor of Science, a Bachelor of Medicine, a Bachelor of Surgery, and also a PhD in Neuroscience. So you're in very good hands here. Orit will be sharing the latest information about COVID-19 from a medical perspective, as well as sharing immune boosting principles from the functional medicine perspective as well. Now we're very lucky to have Orit here with us today. We've also got Angie Savva, so that's me. I'm a Chinese medicine practitioner and a health coach. I've been studying and practicing in the field of natural medicine for over 16 years, and I work primarily in the field of women and children's health. And I run a beautiful multidisciplinary natural health clinic in Springwood called the Kuan Yin Healing Center. I'll be talking to you today about the Chinese medicine approach to promoting good health and immunity, as well as some acupressure points and aromatherapy for immune health and stress reduction. And we also have the gorgeous Ruth Mayroz. Ruth has been studying and practicing acupuncture and Chinese medicine since 1996. She holds a Bachelor of Health Science from UTS, and since her graduation she studied Chinese medicine under the tutelage of various masters in the field, both in Australia and abroad, including USA and Japan. She has a private practice in Katoomba and also practices at the Katoomba Women's Health Centre. She has two beautiful children and is a passionate advocate of a lifelong student of Chinese medicine. Ruth will be talking to you today about Chinese medicine dietary wisdom, how to use Moxibustion at home, and some considerations to bear in mind if you're interested in taking herbal medicine. So just before we get started, a disclaimer here. So I just want to let you know that this webinar is offered for educational purposes only. So the webinar contains general information about medical conditions and treatments, but this information is not advice. It's just offered to you as education. And if you have any specific questions about any medical matter, any personal symptoms or concerns, please do consult your doctor. And don't ever delay seeking medical advice or discontinuing medical treatment because of the information provided in this webinar. So without further ado, I'm going to hand you over to Orit, who is going to first talk to you about COVID-19. Over to you, Orit.
Okay. Can you see it now? Full screen. Okay, fantastic. So this is the topic of today's webinar, separating fact from fiction and giving you some integrative approach to supporting your health. This is the coronavirus, COVID-19, which if nothing else, it's kind of pretty, I think. So just a little bit of an image for you. All right, I just want to, okay, great. Okay, so just wanted to give you a bit of the history, I guess, of the chain of events of how it all happened. So a pneumonia of unknown cause has been detected in Wuhan, China, and was first reported in December 2019. It was declared a public health emergency of international concern at the end of January 2020. And in February 2020, the WHO given that name disease a new name because it was called a novel coronavirus infection until then, COVID-19. So coronavirus disease 19 because it started in 2019. Now, a little bit about the current statistics. So it spread quite quickly around the world, started in Wuhan, China, as everyone know, and from that spread it around the globe. The statistic at the moment are really good. So I wanted to give you a few resources of credible information. So the John Hopkins website is very good if you want to follow the current statistics. So that shows you an live interactive map of the current coronavirus cases. So there are 1,694,954 cases at the moment worldwide, which is quite an astounding number, and about 102,000 deaths. Looking at Australia, you can even see it at the map, actually doing quite well relatively. So if cases by country, although Australia is quite a large country, current cases in Australia are 6,215. If you want to know the New South Wales statistics, the New South Wales Health has a pretty good website that is updated quite regularly. So it has been last updated on the 8th of April. There are 2,800 cases in New South Wales, with 49 new ones reported since the 8th of April, and that was updated on the 9th. Quite a lot of people has been cleared. So total cases tested are 137,000. From them, 134,000 has been cleared. So that's quite encouraging. And there has been 22 deaths since the start of the pandemic in Australia. So these are links that you can follow throughout the length of this epidemic to see how things are progressing. You can even look at case by postcode to see how many cases are in your local area. All right, so just a little bit about the virus. So there are a few different terms that are used, sometimes interchangingly. So the virus itself is called SARS-CoV-2, named of the, so there, it's a family of viruses, and this specific one has been named number 2. The disease is called coronavirus disease 19, or in short COVID-19, and that's the disease that the virus spreads, and it belongs to the coronaviruses family. So it's a virus, an RNA single-stranded virus that it's enveloped, and it's considered to be a large virus. So it's got the largest genome of non-RNA viruses. Now, you may have heard a little bit about ACE2. So the reason for this is because the virus uses the angiotensin converter enzyme 2 receptor, in short ACE2 receptor, to enter into the cells. So it uses it to enter into the cells of the kidneys, blood vessels, heart, and importantly into the lung cells. There are many receptors in the lung cells, which is probably why it affects the lungs more severely. So it can damage the cells once it infects them, and can cause an acute respiratory distress syndrome from the damage to the lungs that can cause the lungs to fill with fluid and to collapse. So that's when the severe pneumonia and a respiratory distress syndrome that you may have heard of can occur. Also, the virus can trigger a strong immune response, and then what's called a cytokine storm syndrome can be created. So that's kind of an inflammatory response that gets out of control. And it's the body itself that causes this storm, and that causes damage to multiple organs in the body, and can eventually cause multiple organ failure. Also, there is a decrease of immune function, possibly due to exhaustion of those patients. And those two phenomena can worsen the respiratory failure. So obviously that doesn't happen to everyone that gets infected with the coronavirus and develops COVID-19. Many people are completely asymptomatic. Others mostly will have quite mild disease. So it's a very small number of people that will develop all these detrimental outcomes. Now, there are other infectious diseases in the past that has been caused by similar viruses from the same coronavirus family. In 2002, you may have heard of SARS, severe acute respiratory syndrome. That one had 11% mortality rate. In 2000, and that one started in China as well. In 2012, there was the Middle East respiratory syndrome, MERS, that had 37% mortality rates. Interestingly, in both of these epidemics, the viruses likely originated from bats and then infected humans through other intermediate animal hosts, possibly camels in the case of the Middle East respiratory syndrome. So as you can see, both these syndromes and both these diseases had much higher mortality rate than the current one. All right, so why has this become such a wide-scale pandemic while with those other diseases, while the mortality rate is much higher, there hasn't been such a worldwide fear and such severe measures were not necessary to stop the spread. So this graph from the New York Times actually shows it quite well. How does the new coronavirus compares with other viruses in terms of its infectivity and the mortality, so the death rate. So with the coronavirus, probably each person, so that's called the R0, each person probably infects between 2 to 4 other people. And that depends greatly on probably on a host attribute, so about on the person themselves. If you compare that to the flu, for example, that is lower. So about one and a bit on people on average will get infected by each person that is infected themselves. Now, looking at the mortality rate, we don't know yet exactly what it is. The range is between, said to be between 0.1 to around 4. Most probably it's between 0.6% to around 4% of death rate. In most countries, it probably will be below 1. So the death rate is quite higher than the seasonal flu, but much lower than SARS and MERS. However, it's probably more infectious than both. And the thing is, because there are so many asymptomatic carriers, that's cause increasing infectivity because people are not aware that they are sick. While with SARS and MERS, you would probably know when you're sick. Okay, so what are the symptoms? Importantly, they may appear after between 2 to 14 days after exposure. So you may be infected with any symptoms for 14 days. The most common symptoms are fever, cough, and shortness of breath. Less common are nasal congestion, headache, a runny nose, sore throat, vomiting, and diarrhea. Recently, it has been reported that a sudden and complete loss of sense of smell may be a symptom of COVID-19. And the spectrum is wide from being completely asymptomatic to severe viral pneumonia. So there is actual online resource. So if you follow this link, you can, and you're concerned, you can actually check your symptoms. So there's a questionnaire that takes you step by step. You can answer some questions. It's that on the New South Wales Gov website, and you will be given some kind of a report to let you know if your symptoms corresponds with being possibly ill with COVID-19. Some people are more susceptible to have a more severe case of the disease. So those are older people, 65 and older, people that live in long-term care facility or nursing home, people that have another chronic disease like heart disease, obesity, diabetes, liver disease, renal failure, cancer, chronic lung disease, or asthma. Aboriginal and Torres Strait Islander people, mainly because they have higher rates of chronic illnesses, and I have this twice a year, and possibly very young children and babies, so infants under 1 year old. So how does COVID-19 spread? So it mainly spreads from a person that is infected to other people that are in close contact with that person, mostly due to droplets that can be spread by coughing and sneezing. Those droplets can remain on, obviously, your hands and also surfaces and other objects that the infected person touches. So there is a lot of uncertainty about surfaces. A recent study has shown that it can stay in the aerosols themselves, so the small droplets that are mixed with air up to 3 hours post that mixture, which is quite a long time. Can remain for 4 hours on copper, 24 hours on cardboard, and up to 2 or 3 days to 3 days on plastic and stainless steel. So that's quite a long time, and that's why it's important if you're out and about, don't touch anything you don't have to touch. And if you do touch something, wash your hands. And when you bring things into your home, best is to take all packages, discard them and wash your hands. Or if you can disinfect with alcohol or hydrogen peroxide, you can do that as well. Luckily, it doesn't seem to be spread by food, so that's quite reassuring. All right, so a very hot topic is testing for the virus, for SARS-CoV-2. At the moment, the most widely used test detects the genetic material from the virus using a PCR. So it's a technology that amplifies the genes so they can be detected, the genetic material of the virus. An initial screening might be positive because of similarity to other viruses, and then a person may need to give another sample to confirm the test. There are certain testing criteria in New South Wales. Not everyone can be tested. The main criteria is being symptomatic with a fever or a history of a fever and a respiratory infection, and to have been in close contact in the 14 days prior to illness with a confirmed case, a history of traveling overseas, being a cruise ship passenger, a healthcare worker, care worker in a residential care or aged care, and living in a geographic area when there is an elevated risk of transmission, and you can check the clusters in New South Wales. However, these criteria have been very recently expanded, and to my understanding, basically, well, to Aboriginals as well, and basically if your treating doctor thinks that due to your history, there is a reason to suspect that you may have COVID-19, and they can refer you to be tested. Now, testing actually can be performed at home as well. So there are testing kits. So you can either be tested in a collection center, or you can test yourself at home and deliver those the swab into the pathology center, and it's quite easy. It's just a single swab that is being used first in the back of the throat around the tonsil, and then in the nose, and puts in the test tube, and that is analyzed. And there is online, there's a list of clinics. There are dedicated clinics for testing, so it's not any pathology clinic. So in our area, Katoomba Hospital and Lithgow Hospital have clinics. And also there are certain private labs like Douglas Henley Moyer, not the ones in the Blue Mountains, but you can look at the list to see which ones, so not all of them, which ones can perform the test. As I said, now you can also perform it at home, obviously, if you're eligible. What is important to keep in mind that we still don't know what is the sensitivity of these tests. So that means what is the chance that if someone has a disease, test positive. So false negatives in certain studies have been reported to be up to 30%. So there is a chance that you can have the disease but test negative. So if you have symptoms that can be due to COVID-19, the safest thing is to just assume that you have it and isolate accordingly. Now, a new test is coming, is actually already available, which is an antibody test. So those are also already available as a point of care testing. Not everywhere. There are, again, criteria for it to be used. They can't be advertised. So there is quite strict regulation around them still. And so those tests can test for antibodies for the COVID-19. This is very important and very helpful because they can test for past infection. In fact, at the moment, they are useful mostly for testing for past infection because we don't know yet how often antibodies that show current infection will show on the test. So you might not test for those antibodies and still carry the disease. So they're not used for that. They're only used to test for past infection. But that is the type of test that will show us if a person has been already infected and probably cleared the disease and now is probably immune. So this is quite important. And that's already available. Okay, so how to protect yourself against COVID-19 and slow the spread. So you probably already have heard this a million times, so I'll just go over this quite quickly. Wash your hands thoroughly and frequently with soap and water, at least 20 seconds, because that apparently breaks the envelope of the virus. Or you can use a hand sanitizer that contains at least 60% alcohol. Avoid touching your face because that's how droplets can be transformed from your face to surfaces. And also, if you have touched something that has been infected with the virus, you can transfer it into your respiratory system. Avoid close contact with people who are sick. Clean and disinfect surfaces that are touched frequently. In order to slow the spread, the best thing is to stay home as much as possible. So only leave the house for essential outings, and that's actually regulated by law. Now, always practice good hygiene. So wash your hands again and practice social distancing. So stay at least 1.5 meters away from other people in public. It's also important to know there has been, again, a recent study that showed that when exercising, so walking in a column, so one person after another, or running, droplets can carry further away, and also because they remain in the air, you can basically walk or run into other person's air droplets. So in this case, it's probably preferable to have a longer distance, so preferably maybe 4 or 5 meters between person to person. All right, so now that's been actually a question that's been submitted to us in advance, so thank you for that. What about masks? Wearing a mask outside of the home in public places is now actually compulsory in some countries, but it is still not recommended by the WHO for healthy individuals. The main reason for that is probably because they don't want to overwhelm the system and not having enough mask remaining for healthcare's use. However, it is possible to use homemade masks, cloth masks, and even those are better than no mask at all. And they can still prevent from some large droplets to be transferred, both from a sick person and when they cough or sneeze, and also some of the inhalation can be prevented. Again, there's a bit of contradictory information. Another study has shown that the aerosols might be too small and would be transferred across simple masks, so not the high N95 masks. But there seem to be some degree of protection. So while maintaining social distancing would still be important while wearing a mask, mask can give you just another layer of protection. Now, what about gloves? So this is just a depiction of how not to use gloves. Gloves are a bit of tricky. I mean, they can be somewhat useful if they are used properly. So let's say if you're going inside a supermarket and you wear the glove just before you enter, and then not touch anything of your possessions until after you remove those gloves, and remove those gloves properly without contaminating yourself, which is not very easy to do. They can be useful. But as I said, you have to not touch anything. So if you touch your phone or your card to pay and you're still wearing the gloves, you contaminated those items. If you touch your face while wearing the gloves, you're contaminated yourself. If the outside of the glove touch your hands while you're removing them, again, there's a risk of contamination. So it probably does not eliminate the need for very careful hand washing, and probably hand washing can replace the use of gloves in most cases. And also it's just another item that will end in the rubbish bin. So possibly washing your hands carefully or using hand sanitizer might be a better option, in my opinion. There are no really formal guidelines about using gloves for the public at the moment. All right, so now what about treatment? It's very important to repeat again that there are no current recommendations for any medications to treat people that have mild or moderate cases of COVID-19, and there are no medications that can be used prophylactically to prevent the infection as well. Several medications have been proposed and have been trialed. You may have heard of hydroxychloroquine, which is an anti-malaria drug, of certain antivirals, antiretrovirals, and even antiparasitics, also some biologic antirheumatic drugs. Those can only be used within a clinical trial paradigm, and those are available in healthcare, so in hospital environment. But there are no current medications that are actually indicated for the use. There has been some encouraging findings with those protocols. So I do believe that in the hopefully near future, there would be some treatment that could be approved. The encouraging fact is all those medications are already approved for treatment of other conditions. So that means that they are approved for treatment of in human population. So there won't be need to go through the very lengthy process of testing in animals before they can be used. Okay, so that is probably the more mainstream doctor side of things. And now I will just really touch briefly on the functional medicine approach of how to support your immunity and health in these times. So again, I just want to emphasize that as the same, that there are no medication, there are no supplements that are approved or have enough evidence to show that they can prevent or treat COVID-19. So all these recommendations are very general to support your immunity. So the most important things are really lifestyle factors. So managing stress and getting enough sleep and exercising. And Angie and Ruth are going to touch on those in more details. There are food and supplement that can support immunity, and I'll touch on those in a little bit more details in a second. In terms of diet, it's important to support your immunity. It's important to avoid high sugar and processed foods. High sugar foods can suppress your immune function. Processed foods that include inflammatory oils can increase inflammation, and that's not something we want to happen when we have other threats around us in the environment. It's important to consume high nutrient foods that can support our bodies to function the best in the best way possible. So some of these foods would be fresh fruits and vegetables that contain vitamin C and also glutathione, organ meats that contain naturally occurring vitamin A and D, and high zinc foods such as oysters, liver, beef, lamb, pumpkin seeds, broccoli, and mushrooms. Zinc is a very important antiviral vitamin that can support our body in fighting viral infections. So specifically, what supplements can be used to support your immunity, but not specific to COVID-19. All right, so as I said, zinc is a very important compound, especially in the form of lozenges. It can support immune function and suppress the attachment and replication of viruses in general. Vitamin D and vitamin A can favorably affect our immune function and defense mechanisms in our body, and modulate those white cell production, the ones that can cause an increased inflammatory response that actually damages our own bodies. Elderberry is a herb that modulates cellular defense and repair mechanisms, and again modulates favorably viral pathological and cellular processes. Vitamin C has been shown in the past to both prevent and treat respiratory infections, and again affects favorably defense mechanisms in the body and modulates viral-induced pathological cellular processes. PEA, I can never pronounce this, palmitoyl-ethylonamide, PEA. It's a short chain fatty acid that our body produces naturally. It has been shown to have favorable effects on prevention and the by modulating cellular defense and repair mechanisms and affecting the viral-induced pathological processes as well. Glutathione is the master antioxidant in our bodies. It supports the immune response and also has been shown in the past to inhibit viral replication. Can be used as a supplement. It's mostly in liposomal form. It's not very well absorbed in other forms. I personally use redox signaling molecules that has shown in the test tube to increase our body's own production of glutathione. It's also contained in certain foods. You can also use NAC and acetylcysteine, that is a precursor of glutathione, to boost glutathione levels in the body. Also probiotics, either in probiotics food or supplements, which support the gut microbiome. Gut microbiome has can have very important antimicrobial and antiviral properties, and it also supports the function of our immune system and the immune response. Now, because that viral infection can cause an out of control inflammatory response, natural anti-inflammatories may be of benefit. One is quercetin that has shown in the past to inhibit viral replication and also reduces inflammation and stabilizes mast cells those mast cells, when they degranulate, they can cause fibrosis. So that helps with stopping that. And curcumin is another example of an anti-inflammatory compound that can reduce inflammation. There are many, many more. That is just a very general run through. I'm not going to go into any dosing frame, but there are actually lots of information available online as well. And also, our two other lovely presenters are going to go into more details of ways for you to support your immunity and your health. So with this, I'm going to pass the baton to the lovely Angie.
Thank you, Orit. Oh, that was wonderful. Thank you so much. It's so great. As you said,
Which was really strange. I couldn't see myself.
oh, really? Oh, you look beautiful. And it was so, you know, as you say, this is so much information. It's really hard, feels a bit overwhelming to sort of sift through it all. So just want to thank you for doing that, for sifting through and, you know, like picking out all the really most relevant and important and helpful pieces of information.
I hope it was helpful and not too much information.
Well, I think it was beautifully paced, and if anyone has any questions, just make sure you can always pop any questions in the chat box. We might wait until the end to go through all those questions, and at the end you can unmute and like put yourself on camera if you want to, you know, like to ask the question more personally. But yeah, as we go, just please feel free to ask away. All right, so now we're going to be moving on to my part of the presentation. So, yeah, so again, I'm Angie Savva. I'm going to talk to you today about the traditional Chinese medicine approach to immunity. So Orit has already talked about, yes, the Western medicine perspective and then the functional medicine perspective to supporting our immunity in a general way. And yeah, to complement that, Ruth and myself are going to be talking about Chinese medicine approaches to also strengthening and supporting your immunity. All right, so yeah, so according to the theory of Chinese medicine, your body is made up of lots of different kinds of qi, which is roughly translated as energy, and they all have different functions in the body. So one type of qi is called wei qi in Chinese, which is roughly translated as immunity. So this wei qi is your body's natural strength and your ability to fight off pathogens like viruses and bacteria. So this has been built into Chinese medicine theory for thousands of years, that when this particular type of strength, this wei qi, it isn't strong enough, then we're not able to fight off the external pathogens and we get sick. So there are numerous quotes in the classic Chinese medical literature dating back, you know, 1,000 years that highlight the importance the Chinese place on preventative medicine, such as this one. This one was from the 1st century. So the superior doctor prevents sickness. The mediocre doctor attends to impending sickness, and the inferior doctor treats actual sickness. So that this has been such an important part of their philosophy. And this is another one from the 4th century BC. So to cure disease after it has appeared is like digging a well when one feels thirsty, or forging weapons after the war has already begun. So, you know, the ancient Chinese doctors were the original lifestyle coaches and health coaches. So in fact, actually in earlier times, Chinese medical doctors were only paid as long as their subjects stayed well. So which surely would have acted as a strong and powerful incentive to keep their patients well, to keep them from falling ill. So I just think what a different landscape our health system would be if we had that same approach to prevention today. But that's why, you know, it's so important for us to be starting to think about even more and changing things in our lives to make sure that we're staying strong as much as possible. So what can weaken our wei qi from a Chinese medicine perspective? And I'm going to be dovetailing this into Western medical research as well. So there are 4 main things that can weaken our Wei Qi, or our immune system. So number 1, when there's qi stagnation in the body, that's a Chinese medical term. So if there's excess stress or mental tension, then this causes blockage or obstruction. It blocks the flow of qi. So the Wei Qi can't flow properly and protect us. And from a Western medicine perspective as well, we know that, stress dampens the immune system. Our immune system doesn't recognize the difference between physical or emotional stress. So our immune system responds to both kinds of stress the same way, by creating inflammation. And psychological stress has been shown, has been associated with a decrease in the ability of our white blood cells to kill germs and an increase in inflammatory cytokines. So number 2 is when the digestive energy is weakened through poor diet or overwork or stress again, then our digestive system can't transport the nutrients from the food around the body, which leads to a deficiency of the Wei Qi. And again, this link has been validated with medical research. As Orit said, the microbiome is so important for our immunity. A large percentage of our immune system is actually located in our gut. Some estimates between 70 to 80% of our immune system in the gut-associated lymphoid tissue, or the GALT. So the intestinal immune system produces more antibodies than the rest of the body put together, and the important immune functions of the digestive systems can be compromised by an unhealthy gut microbiome. So, like the Chinese were all over this so long ago. Number 3, when the lung qi is weakened from grief or pollution or illness or allergies, then the lung qi is another type of qi. It can't effectively turn our breath into the qi need to protect ourselves, that Wei Qi. So the lungs are said to control the Wei Qi. They have a very strong role in our immunity. And so when the lungs are weakened, then the Wei Qi automatically suffers. And we're seeing this correlation very clearly right now with the current coronavirus pandemic, with people who have a pre-existing lung condition are at a greater risk of developing serious complications from the disease. And 4, so constitution. So the Chinese concept for this is when our jing, or our essence, if our constitution isn't strong due to genetic factors, then all of our body systems suffer, including the Wei Qi. And this is again corroborated in Western medicine. Some people are born genetically immunocompromised, or they're missing some of the body's immune functions, or their immune system doesn't function properly, which leaves them more susceptible to infection. So what can we do to understand all of that? What can we do to make sure our Wei Qi is healthy and strong? So number 1, stress management. Because let's face it, we're living in a very stressful time right now. There's, even if we are managing okay individually, the collective stress and anxiety is enormous. So it's vitally important that you're building in stress management techniques and strategies into each and every day, and more so than ever before. And there are so many different ways you can do this. So, including meditation and mindfulness, acupressure. I'm going to be talking about that soon, doing some sort of meditative exercise like Qigong, Tai Chi, or yoga, journaling, aromatherapy, or even just sitting outside in a green space for 20 minutes can actually lower your stress hormones. So number 2, having a healthy approach to food and diet. So this includes what we eat as well as how we eat it. That can be just as important as what we are actually eating. Elimination and energetics of food and cooking. So Ruth is going to talk about that shortly, so I'll leave that for her to share with you. Strengthening our lung qi. So there are many things we can do to strengthen and support the health of our lungs, including fresh air, deep breathing exercises, acupuncture and acupressure, and Chinese herbal medicine. So I'd like to really emphasize the importance of getting outside every day. because the air that we breathe that's the air, that's the chi, that's what's turned into chi inside our bodies by the lungs. So trying to spend at least 20 minutes of every day outside, regardless of the weather. Like that could mean taking a walk in the sun, standing on your veranda watching the rain. I'd also like to encourage you to make sure that the air inside your house is as fresh as possible, especially since we're all spending so much time inside right now. So that might mean just opening your windows as much as you can, having lots of houseplants, or getting an air purifier. And healthy lifestyle. So now unfortunately, we can't do anything about the genes we're born with, but we can have some influence on the expression of those genes through having a healthy lifestyle. So in Chinese medicine, this is called nourishing the post-heaven qi. And in Western medicine, this is epigenetics. So that includes everything we've already talked about. So things like ensuring you have good quality sleep, having a healthy work-life balance, living in harmony with daily and seasonal rhythms of nature, and having a healthy living and work environment. So just like to speak a little bit more to the sleep piece here. Our body replenishes on many deep levels during sleep. So if you're not getting enough sleep, and from a Chinese medicine perspective, if some of the more internal energies of your body are weaker, then the Wei Qi has to work overtime to keep you healthy, and it can't sustain that indefinitely. And the Wei Qi moves inside our body during our sleep to nourish and protect us internally. If it doesn't have enough time to do that before it has to go back to the outside of the body to protect us when we're going about our day, then we're weakening our Wei Qi and leaving ourselves more susceptible. And from a Western perspective, an increase in sleep actually increases the number and ability of your white blood cells to fight viral infections more effectively. So getting your sleep is so important for your immune system. On the other hand, a loss of sleep, even for a few hours at night, even just over a very, like a couple of nights, it can increase inflammation in our body, which makes us, again, more susceptible to catching infections and having more severe symptoms. So making sure that you prioritize your sleep and make sure your whole family is getting enough rest is super important. So what else can we do? So I'd like to talk a little bit about acupressure now. There are specific acupoints on the body that can nourish our Wei Qi to help us prevent sickness, that we can stimulate ourselves at home every day. Acupressure can also strengthen other energy systems if they're not supporting the Wei Qi sufficiently. So what is acupressure? Acupressure is the application of to-form pressure on various points of the body to produce a therapeutic effect. So these points are the same as what we use in acupuncture, it's just the method of stimulating those. Acupressure is so wonderful. I love it so much, and I love teaching it and sharing it with my patients. It's an empowering tool, self-help tool. You can use it anywhere, anytime. It's free. You can give little acupressure routines to your family. It's such an effective way to bring about positive changes in your body and mind. So it's just a really useful to have up your sleeve. So yes, I'd like to show you some acupressure points that can be useful for keeping your immunity strong. And as you're pressing the points, it's nice, you don't have to, but if you have the time and the inclination, while you're pressing the points, just close your eyes and really focus on your breathing, because then you're incorporating also the stress relieving effects and lung strengthening effects of deep breathing, and really having those lovely long slow breaths. And holding each point for between 1 to 3 minutes on each side with a gentle but firm pressure. So 4 of my favorite points. We've got stomach 36 here, which is one of the most famous points in acupuncture. It's one of the most powerful points in the body for increasing energy, vitality, and digestive function, as well as enhancing immunity and building up the body's defenses. It's got an interesting story behind it. So stomach 36 is having a mental blank. Susan Lee. No, wait. Oh, Ruth.
Yeah.
I'm having a mental blank sitting. Okay, so it's walk 3 miles. So cis-only translators walk 3 miles. So the point's repeatedly named after noticing that. You know, when they're driving, they were marching the soldiers across ancient China. They'd be driven to the point of exhaustion, but if they could press this point, cis-only, they could walk 3 more miles, get 3 more miles out of them. So pressing, so you find this point 4 finger widths below the lower border of your kneecap, the patella, and 1 finger width lateral to the tibia. So, you know, you can see in the diagram there, you're just going to the outside of the shin bone. And you use that moderate pressure with your thumb until you feel an achy sensation. And alternatively, if that's a bit uncomfortable to reach down that way, you can use the heel of your opposite foot to just rub that point vigorously for about 2 minutes. But just be careful if you do this, because I've given myself a friction burn by doing that a bit too enthusiastically in the past, so you just be gentle. All right, so that's stomach 36. So next point is large intestine 4, which is known as the master point for pain. And you might have heard that this point is really effective for treating headaches, which it is. It's also a domestic congestion point, anti-inflammatory. And according to Chinese medicine theory, it strengthens the immune system by helping to expel external pathogens as they're trying to invade the body. And yeah, so you can find this point at the highest point of your muscle. When you bring the thumb and the index finger together, there's a little bulge. You can see a little bulge of muscle. So the highest point there, you're pressing down in that webbing, and it should feel a little bit tender. So this is an easy one to do. I'm always pressing this one through the day. It's so easy to do. But just please note this point's contraindicated in pregnancy. So if you're pregnant, please don't use this point. Unless you're wanting to go into labor because you're at 40 weeks. So next point is CV17, conception vessel 17. So this is a beautiful point. It's located in the center of the chest. So if you find the tip of your sternum, and then with your other hand, just measure out 4 finger widths from that tip of the sternum, and then it's right in the middle there. You should feel a little depression right in the center of your chest. So this is a beautiful point because both on a physical level, it opens up the chest, opens up and helps to clear the lungs. It stimulates the thymus gland, and it also has the emotional sort of balancing qualities in helping to decrease anxiety and worry. It has an uplifting effect, opening, like this, just this real opening up sort of action that it has. And anything that we can do, you know, to help uplift and open up, you know, like this, our chest area is really wonderful. And then finally, one of my super most favorite points, yin tang. Yin tang is an extra point, so yeah, it's here in the midline between the tips of your eyebrows, just here. The third eye point has a powerful action on calming the mind. As a deeply relaxing point, helps to reduce stress. And there's been a lot of research into just this single point, which has been found repeatedly in clinical trials to significantly reduce anxiety levels. So that's yeah, that's a good one for all of us, I think. I find when I press this point, it actually feels really nice after maybe like 30 seconds or so. It feels really warm and just really pleasant. So it should feel very pleasant. So you're not going to be pressing really hard. Your face is obviously quite sensitive, but yeah, it should be a lovely sort of feeling. So yin tang is also very beneficial for the nose and the eyes, good for any sort of sinus congestion, and it's good for frontal headaches as well. So you can combine yin tang and CV17 if you like. You can do the two of them together. Where's it? I've lost my arrow. Okay, so actually I'll just go back. Yeah, so just finishing off with acupressure. I mean, acupressure is very flexible. It's a very flexible self-care technique. So there's no hard or fast rules. You can just do one point here or there through the day as you think of it. Put it all together and make a kind of a routine. Just set aside 10-15 minutes and just work through all those points one at a time. Again, focusing on your breathing, maybe making yourself really comfortable in a really relaxing part of your house. And you could do that every day as a general sort of maintenance routine, or if you feel that something's coming on, you might like to increase that to 3 times a day. And there's more points you can use as well. That's just an introduction. Okay, so moving on to aromatherapy. Am I okay for time, you guys? So there are many essential oils that demonstrate potent antimicrobiological properties in clinical studies. So, acupuncture, aromatherapy is very popular now. I know there's a lot of people who really like using essential oils, and that's wonderful. And they are really wonderful substances that nature has given us. They can play a supportive role for relieving both physical and emotional symptoms in a general way. However, I'd just like to note again, it's important to know that even though an essential oil might have been shown to have antiviral or antibacterial or antifungal effects, that doesn't necessarily mean it will have an action against all viruses, all bacteria, and all fungi. Usually in a clinical research, they'll be testing essential oils on specific strains of virus or bacteria and in specific context outside of the body. So, so just be very careful about how you interpret the information, and just don't rely on essential oils for cleaning and disinfecting against the coronavirus, as Orit went through before, all their the standard procedures around infection control guidelines. So, you're not going to be substituting essential oils for the government approved disinfectants. But that being said, for general intents and purposes, there are many essential oils that you can use to help reduce the overall level of pathogenic microorganisms in the environment. So here we go. So I've just got a list of some lovely been shown to have antimicrobial functions. For example, so we've got sage, cloves, cinnamon, thyme, tea tree, eucalyptus, peppermint, and lemon. So very, when you imagine the smells and the herbs and spices these come from, they're very, very strong, sort of opening up sort of aromas. Sage in particular is it's very powerful. It's been shown to have a very wide range of action against a number of microorganisms, including a lot of different viruses and bacteria. Very interesting research showing sage was effective against the first SARS virus. That was in a hospital setting. They were testing the essential oil against the mucus, in a laboratory. So, we can't make extrapolations of that to the current coronavirus or anything else really. But I just think it's really interesting that, these properties from our plants, can be very powerful. So, and there's no harm in, popping some sage in your aromatherapy diffuser if you like the smell. Sage is really interesting. It's got a high vapor permeability, so it permeates through the air really effectively and really quickly. So it's a good one for helping you to just cleanse the air. And in terms of stress and anxiety, many of us know that essential oils can have a supportive effect on helping to reduce anxiety. For example, lavender is very well loved and known for helping to induce feelings of relaxation. And so at this time, when we're under such an enormous amount of stress, you might like to experiment with a few different essential oils and see if they help you to feel more calm. So I just got a list of some of my favorites there. So lavender, rose, jasmine, orange, geranium, bergamot, chamomile, and clary sage. So you can either, just use single oils, or you can buy a blend or make your own blend. You can pop the oils in an aromatherapy diffuser to help disinfect the air generally, or to create a relaxing and calming atmosphere. You can also make a natural general disinfectant cleaner by combining white vinegar, water, and some essential oils in a spray, or making a room or a body mist by putting essential oils in some water or floral water, just with some sort of solubilizer to help the essential oil be diluted, diffused in the water. And if you have got like a lovely lavender or some other relaxing spray, just giving yourself this, so it can be really relaxing. You can even put some drops in your laundry, to help freshen up your laundry and help them smell really good. But please never take essential oils internally. This is really important. It can be toxic and really dangerous unless you're under the supervision of a qualified clinical, medical, or so that wraps up my part of the presentation. I'm just going to unshare my screen now, and I'm going to hand you over to Ruth, who's going to be talking to you about TCM diets and Moxibustion and herbs. So thanks for your time. Take it away, Ruth.
Thanks, Angie. Can you hear me?
Yeah.
Great. I'll try and share the screen with this PowerPoint. Okay. Yeah. Can you see this?
Yeah.
Okay. All right. Here we go. Great. Thank you so much, Angie and Orit. Angie, you've made my life a little bit easier by explaining certain concepts in Chinese medicine, and that's really great. It's really good to be here. I wanted to mention from just to add on from Angie, and really, it really just emphasizes what Angie said, that our immune system is really the sum of a lot of other body functions, and that's really, really important to keep in mind. It's not something separate. And we can also see from what Orit was saying, the people who are most vulnerable and are most affected by this COVID-19 virus and have the worst kind of case scenarios are people that are really either quite, age is a big factor, but also other diseases are a big factor. So it's not just, is your immune system strong enough? It's like your immune system is strong enough if your baseline is strong. So it's really the sum of all other body functions. So we really are required for this virus, for the next, hopefully not happening pandemic, for whatever it is, we are really required to always protect what our weakest link is. And that could be, is it our respiratory system? Is it our digestive system? Elimination, which includes sweat, urine, bowels. Do we have a lot of pain and inflammation, which is something that we are, that our system has to continuously deal with, and that can make other resources a little bit less available for our bodies to deal with when then there is another attack of a virus or something else. So we really need to look at all those things, and it's really important to address them while either when we are having in the midst of this pandemic and in general. Also, as Angie mentioned, like stress and sleep are super important, and so I won't repeat that. So in general, in Chinese medicine, there's no one size fits all kind of approach. So everyone should take this to improve that. It's more, we all have different constitutions. We all are born with a different starting point. We are born in different climates, our life experiences are different, and our constitutions are different. So we have to kind of take that very much into consideration. But there is a certain baseline that we all need to look after and to protect. It's a bit like, there's different cars out there, different models, different types, and they require like different levels of maintenance depending on the model, depending on you know, what terrain they usually cover, if they only go off-road, if they just do, you know, just go on highways, if they're in a congested urban environment, and also the distance they travel, the age of the car. And so we kind of have to kind of look at that, but we all know that cars need fuel, but we also need to remember not all fuel is good for all cars. And we know that all cars need some level of maintenance. So today I'll actually talk about the maintenance requirements. And as humans, we do have a few things that are that we all have in common, regardless of our constitutions and our differences. We all need warmth. Our bodies are about 37 degrees, roughly, just a little bit under. And we need to be able to maintain this level of warmth in the body in order to maintain function, in order to maintain good metabolism, good digestion, good immune system. So what aspects of warmth do we need as humans to maintain this life that we have? So we need light. We need to maintain, as I said, the body temperature, because a dead body is cold. You know, this is one of the ways to, you know, a dead body is basically cold. So we need to maintain this warmth. We need also warm foods. We need warm emotions. We need kindness. We need care. We need compassion. We need love. Nobody wants to have cold and hostile friends. And if you have cold and hostile friends, maybe, you know, this social distancing time is a good time to reconsider your friendships and your relationships. Warmth is an essential key in Chinese medical therapeutics. And today I'm going to mainly speak about diet and Moxibustion. If you had acupuncture in the past, you may have come across Moxibustion. And these two things, diet and Moxibustion, also herbal medicine, they're great ways to be able to supplement the body with warmth. So I'll do a little bit of show and tell. Can you see me at all or not? Yeah. Okay. Great. So Moxibustion is basically processed mugwort, which is a very common plant. It grows on most continents, and it sort of looks, after it's being processed, it kind of looks like this rock wool a bit, and that's sort of the raw form of it. And then usually what I'm going to talk about today is what you do with that is you kind of, when we talk about Moxibustion, we usually talk about burning this herb, mugwort, on or close to the skin. And so today I'll just concentrate on two ways of doing it, and that's with either a moxa stick. Can you see that? Yeah, a moxa stick, and they come in different sizes and in also different kind of makes. Some of them are smokeless, some of them have more smoke, but there's also another way of that I'll talk about today, and that is like little, they come in prepared stick-on forms, which is, you basically just take this little thing, it comes already, it's with an adhesive, and say if you wanted to put it on her gu, this large intestine 4 that Angie showed before, you just stick it on, and I'll show you in a minute how to do this. So before I'll show you how to do all this, you need to know a few things. Why would you even think of burning something close to your skin? That doesn't sound like a very pleasant or safe thing to do, but it is. Okay. Just make sure, first of all, that the room is ventilated, but I'll talk a little bit about what the properties are of Moxibustion and why it has a very, very long history. And in Chinese medicine, it's even said that what needles and herbs can't cure, Moxibustion can cure. It's a really very, very powerful thing. And, you know, generally it's quite a cheap thing. And you can do it yourself, you can do it at home. Of course, there are more complex cases, and in complex situations, it might be a good idea to, you know, consult a practitioner. But just for self-care, it's really a great thing to be able to do. The properties of mugwort from a Chinese perspective is that it's warm and it's pungent in its smell. So it has this penetrating aromatically, like a little bit like essential oils do. They are, because they're aromatic, they are quite penetrating. So moxa is the same. It warms, it scatters cold, it improves circulation of qi and of blood. It eliminates fluid retention, including all manner of pathological fluid like mucus and phlegm. It stops pain, dispels toxins and fevers, and prevents disease, strengthens the body, and prolongs life. The mechanisms, there are 3 mechanisms. There's actually just recently, just in the last week, I think, there's it was a journal article that had a lot of research on on the mechanisms of Moxibustion, and they mentioned 3 main mechanisms, and one was heat, the other one was infrared, and the third one was smoke. So the heat, what the heat does, it increases blood flow in the small vessels, especially if you put it over an acupuncture point. If you burn the moxa over an acupuncture point, you will stimulate the small vessels, and it reduces inflammation and infection. It increases the elasticity of connective tissue, heating the skin. Actually, with moxa, they've done studies where they compared moxa to just a cigar, to some other heat source, and they found that the heat of moxa was the most penetrating, and it increased the internal body temperature by 3 degrees. It doesn't increase your entire body temperature, so it's not like you're going to run a fever, but increase the on the particular point, it could actually increase the temperature by 3 degrees, and it penetrates about 1.5 centimeters internally, and the heat is higher and it stays longer than other heat sources. So that, I thought that was quite an interesting research. The other thing that that research came up with is the infrared aspect of Moxibustion. And what that does, it increases the respiratory activity on a cellular level. It vibrates water molecules, which reduce, increase, speeds up blood flow, and induces cell division and enzyme activity. So it helps with repair quite markedly. And the last thing was smoke, because there are a lot of smokeless kind of additions of this stick and of the and although they do have the of the original moxa punk, it's called that moxa wool, and although they still have benefits because of the warming ability, but the smoke actually has its own benefits, because what they found, that inflammatory markers went down as smoke density went up, and about 30% of the smoke contains eucalyptus, which is a great a known organic compound, which is an anti-inflammatory agent. So there is actually benefit in inhaling the smoke of this. Now, if you do this all day in when it's in a closed space, I don't, it's actually has, of course, some risks involved, but you know, if you're just doing it yourself and you're doing it in a ventilated room and you're not doing it with, you know, 5 other people all doing it at the same time for a very prolonged time, it's actually quite beneficial. So I thought I'd just show you how to do this, how to light those Moxa sticks, and then I'll show you some points that are particularly beneficial to keep the warmth in the body, help the body produce that Wei Qi that Angie spoke about. And also just the general qi of the body, you know, because we need all the different aspects of qi to maintain all our body functions, not just the defensive or the Wei Qi. So the best way to do it is to you need a lighter or you know, anything you can light a candle like that, and then what you do, and I'll do it with the little one because it takes less time to light, and you just go like that. Can you see this? Is that clear? Yeah, you just put the tip of it over the flame. It might sort of, you blow on it a little bit. It needs to be sort of glowy inside and out.
Ruth, sorry to interrupt.
Yeah.
Would you mind maybe stop sharing your presentation so we can see?
Yeah, okay, yeah, I will do that. Stop share. Yeah, okay. Can you see is better now?
Yeah, thanks.
Right, okay. So you just do that. And I don't know if you can see. Can you see that it's glowing inside? It has to be red inside and out. And basically you put it over a point like that, and you hold it there, and that's kind of a good way. Now put your little finger on the skin so it's stable, you stabilize that, you put it over the skin, and it gets too hot, and then you press, and then you do it again, and you do it for a couple of minutes on the same point, and then you can move to the next point. Now to put this out, what I've got here is a very sought after thing, food item. It's rice. If you still have rice, otherwise you can use any dry kind of, you can use sand, you can use anything like that, millet, whatever you've got, and you just kind of put it in there. Just don't put it out by putting it under a tap or dabbing it into something moist, because it will have a lot of difficulty relighting it again, and it sort of ruins it a bit. So so there's 3 points. I'll just give you 3 points for the sake of, which I think are very powerful points to Moxa. So one of them was stomach 36, which Angie already spoke about when she spoke about doing acupressure. The other one is called large intestine 10, and that is really the hand mirror of that stomach 36. So basically, if you go just below the elbow, if you go between your thumb right there and just about 4 fingers from the elbow, can you see this properly? It's kind of on that line is that point, and that's a really good point. I'll just see, can you see? I'll mark it with that, and that's a really good point to also Moxa. I'll show you how to Moxa those things. Those ones are more closer to the skin, and they have it's beneficial as close to the skin as you can. And what you do, you need another stick to it's like a specialized incense stick, and you light that, And with that incense stick, you can light that little cone. But you can also do it with, with this. You can just go, you can just use that bigger moxa stick for the same purpose instead of using those stick-ons. Okay. So stomach 36 was one of them. This one, which is called large intestine 10, is a great point. And the other one is basically your belly button. And that's a great point. That belly button, this is where we got our initial nourishment from in the womb. And it's a fantastic point. It really, you can, if people are very cold, very deficient, they have lots of digestive problems, they have chronic diarrhea, even the studies of chronic fatigue, where this point was moxed regularly, and people had experienced great benefits, really had, a very significant improvement in their condition. So moxa is great. It's good to do something like that daily or at least a few times a week. And that is really quite strengthening, and those points, you cannot really go wrong with those points. And I think it's a bit like the points that Angie showed. There are points that you have to be a bit careful with, that that might not be applicable in all situations, but these points are safe and they're very beneficial. Are there any questions around Moxibustion so far?
Yeah, Ruth, there was a question here from Anna. She said, what about if you are going through menopause and you have excess heat anyway? Or what if you have a hot constitution or a hot condition? What would you say about using moxa then?
Okay, I would say it's a really good question. And it's also a question that the answer to that question, there's a debate in the Chinese medicine community whether, people with heat conditions could use moxa. I think stomach 36 can definitely bring heat down. So if people with menopause have, they can still moxa stomach 36 really quite safely. But Moxibustion is also known to reduce heat and fever. So it can be useful, but you need to be shown more specific ways of doing it. There's the different techniques and also different points, most probably. Does that answer the question, I hope? Any other questions? Okay, so the only thing is, if you have neuropathies or you have issues where you cannot feel the heat, please maybe don't, just be very careful and maybe don't do it, because you can burn yourself because you won't be able to know when too much heat has been applied. So it's best to avoid. I'll go really, really quickly into diet, which is a minefield, because everybody, if you look up diet or what should I eat, and there's like probably 5 billion entries that come up on Google. I will stick to the same tenet that you actually have to maintain warmth and support function, and that's a really big thing in Chinese dietary therapeutics. We always work, there is no one size fits all in Chinese medicine when it comes to diet or anything for that matter. We always work with the terrain. We always support the person and then get rid of a pathogen, and not vice versa. So there's no really, we don't talk about superfoods and, fad diets. We eat, what I suggest in this time is that you eat foods that most agree with you and that you are finding easiest to digest. And most of us will do well on warm foods, warm and wet foods, because that kind of goes straight into the stomach. The stomach is really, from a Chinese medicine point of view, is where the wei qi is produced, and it's being steamed out to the surface to protect the surface of the body. It needs to be warm and wet. And so things like porridge, congee, soups and stews, they're fantastic. to make them a little bit more warming and easy to assimilate is if you add some ginger, scallions, fennel, fennel seeds, cardamom, dill. These things really help digestion. They really promote digestion. There's other kitchen herbs and garden herbs like oregano, basil, thyme, rosemary, coriander, parsley. They're really good for lung support, you know, so they kind of bring it all the way up to the surface, and they're great to support lung, and they're great for when you have coughs and colds. The thing, you know, with soup, it could be any soup, vegetable soup, chicken soup, lentil soup, pumpkin soup, split pea soup, whatever soup you like to make, and always just try and kind of add some more, you know, add some of those herbs and spices like fresh ginger, scallions, fennel, etc. The one thing that is really also important to remember is that to avoid drying foods, like things like, you know, crackers, too much salt, very spicy foods, like too much chili peppers and cayenne peppers, tea, coffee, and as mentioned before, junk foods, because they're very dehydrating. They're, you know, to actually have a good immune system, you need to be hydrated quite well. Like Angie mentioned before, other things that impact dehydration are also lack of sleep and stress. They're quite dehydrating in nature, so it's good to avoid those. You can also just be mindful to kind of keep hydration up. So also things like ginger tea, just fresh ginger with some hot water with a little bit of honey and maybe some lemon and lemon rind, or orange peel and cinnamon and cloves. Just drink some warming fluids every, you know, about every hour. You don't need to have a huge mug of it. You can just drink small cups of it, and that should be enough just to keep you hydrated. Even just warm water is fine, you know, every now and then. Just a bit of warm water is great. And I know we're really kind of going over time here. I just want the last word on herbs. Herbs is a huge subject, and herbalism in all tradition is an age-old practice which has been refined over a very long span of human history. And again, herbs, there's no one size fits all in Chinese medicine. I just wanted to really caution all of us, because with this panic, there is so much, you know, we grasp for something that we want to protect ourselves. There's a lot of products out there on the shelves, in the supermarket, in health food stores, in pharmacies, that have, like, you know, immune booster, immune support, this and that. And it's not they're not necessarily what you need. You might just be really wasting your money when it comes to herbal medicine. That might actually not only be useless to you, but some of it might even harm you. So there's a lot of things that have, say, astragalus in them, which is a great immune supportive herbs, but it's only really great if you are totally healthy and you actually you don't have anything at the moment. And as soon as you get something, you should actually go off astragalus. It's not actually a good herb to take. Oh, I'm coming down with something, I better take some astragalus. It's actually really contraindicated in Chinese medicine. And the other thing is, I'm having a mental blank. Chuanqinliang, andrographis. Andrographis is very, very cold. It's extremely cold, and yes, it can kill bacteria. It kills certain types of bacteria, and it's actually not, you know, in this climate, going into winter, it's not a great prophylactic. It's not a great preventative. It actually will cool you down, and as we have just discovered, you know, keeping warm is really, really important. So andrographis is not a great one. So just, it's best to consult with someone, with a herbalist, whether it's Western or Chinese herbalist, and then, you know, go out and buy stuff. It's actually much better than to just spend your money out of this kind of panic mode on all kinds of things that are out there. And also, the other thing, the one last thing that I wanted to say about herbs, just like with food, you know, if you look at a package of a 2-minute noodle and it might have like dried vegetables in it, you don't consider that vegetables. And just like from that to also, you know, you can have a really fresh cucumber and you can have a really limp, kind of half rotten cucumber, and they're all, you know, they might all be considered vegetables, but you really want the great fresh cucumber. You don't actually want anything that's either limp or dehydrated in a packet that comes with 2-minute noodles. But they all can be considered vegetables. So also, you know, the fact that it says vegetable, that it says that it has a particular herb, we don't know in a lot of those products what the base level of that herb was. You know, we don't know if we got a limp cucumber in there or a fresh one. So that's all from me. Thank you, and great. Angie, back over to you.
Oh, beautiful. Well, I think that brings us to the end of the formal part of our presentation. I had a little thank you slide for just some contact details for us. But now it's time for some questions. So if anyone has any questions, please feel free. I think there was a question about where to buy moxa. If you have, I know that the House of Moxa has really beautiful moxa, but do you sell it yourself, or do you have any other recommendations of places to buy it?
There are lots of online options. I sell it in the clinic. I think also with, you kind of, you know, moxa there's different qualities out there, and it's better to get, like with anything else, it's better to get good quality moxa and use that than getting some shoddy quality. So people are welcome to contact me and ask me questions about that later on. You know, I'll be happy to answer questions about moxa quality.
Okay, wonderful. Does anyone else have any questions? You can put them in the chat or just unmute yourself. Okay. So, Orit, can you see that question there?
Yes. So I can see one question from David, please. There has been some mention that some herbs, elderberry for example, may contribute to creating a cytokine storm immune system reaction in conjunction with COVID-19. Just wondering if there is any specific cautions or advice in this regard. I understand there has also been some reaction between the virus and ACE inhibitor drugs. Yes. So that is correct, that there were early on concerns about elderberry and the fact that it might enhance immune reaction and thus contribute to the cytokine storm. So just to recap, cytokine storm is there are a type of immune cells, and they can be overstimulated by the virus, and that causes a kind of an inflammatory storm in the body that does the most of the damage. So that creates more damage than the virus itself. So yes, there has been early on some concerns about elderberry, but it has in practice it hasn't been shown to be an actual issue, and it seems to support the immune system rather than overstimulation. With ACE inhibitors, there is still a lot of controversy. So as we've already mentioned, the way the virus enters the cells is via the ACE2 receptors, the receptors for the enzyme. So initially, ACE inhibitors are blood pressure medication that can block the receptor. So initially it was thought that that would probably be a beneficial effect because it would block the receptors the virus won't be able to use that receptor to enter into the cells. But then there has been a concern because it is possible that those medication can actually increase the expression of the receptor. So thus there were concerns that can actually make the people more susceptible to the virus. There has been a recent study that has shown from a group of people, all with high blood pressure, that had COVID-19, those on ACE inhibitors and ARBs actually found to have a better outcome than those that weren't on those medications. So that's only one study though. So there is no really, we don't know yet the answer to that. So the recommendation at the moment is for people that are taking those medications for to reduce their blood pressure, not to stop taking them, but also not to start anyone on ACE inhibitors or ARBs in order to prevent or moderate the effect of the virus. And don't know enough. And there's more needed and more experience in the field, and things are changing every day. So maybe there is something new today that I haven't heard of yet, but that's the most recent information that I personally have. And now from Sonia, any thoughts from circulating? Is that okay? So okay. Same question from Sonia. I hope that answered those questions.
No, it's so interesting, isn't it? I was hearing that apparently it all came back to one study. There was like one very small study which only had 10 people in it.
That's right, and often it's it's theoretical risks as well, and then in practice, this is really
cool. Yeah, sorry, talking over you. Anyway, oh, thank you, Leslie. But I guess just going back to elderberry, if you are concerned about a specific type of herb, as Ruth was saying, you know, if you're wanting to take herbal medicine and you're not sure, or you're not feeling comfortable or confident with the particular herb or whatever, then just to consult with a professional herbalist, whether that's a Chinese medicine herbalist or a Western herbalist, or, you know, yeah, there's just, yeah, before taking herbs, always good just to check with a professional and make sure it's the right herb for you.
And I actually had a question about aromatherapy with those oils that are recommended for immune boosting or antibacterial, antiviral. Are there any combinations that shouldn't be used, or you can use whichever combination you would like and they will just enhance each other?
I don't think it depends how you're using them. If you're using them to in an aromatherapy diffuser or in your cleaning products, I don't think there's too much concern about any contraindications. If you're talking about putting it on the skin, there's things we're talking about. Is that what you were?
Both, I guess. Yeah.
Like some essential oils do have, can be contraindicated, can be very irritating or sensitizing to the skin. So cinnamon, for example, can cause like skin reactions. So yeah, so that will be, you just have to be very, very careful about anything you're putting on your skin. And of course, like you wouldn't be taking anything internally, but through like the air in cleaning, that should be fine. I know the particular combinations that don't work well together. If you're interested, actually, David posted a really great article on the Blue Mountains practitioner page, which was from the Tisserand Institute. So the Tisserand Institute is a very, very well-established and reliable source of information on aromatherapy. So I can put that link in the chat box, and they've got some really amazing articles on essential oils for treating, like summarizing all the current research about essential oils for treating and preventing the flu. And then there's an article about what we can extrapolate from that to applying it to the current situation with the coronavirus. Although they're very, very, very careful to say, you know, like this, we can't make any, you know, like this, we cannot make any concrete sort of recommendations, but you know, this is what we have found from previous experience that can be possibly, potentially be beneficial in a cool way. So I hope that made sense. So it's just the Tisserand Institute. I'll pop that on the chat box.
Thanks, Angie. Thank you. Thanks, Angie. Thanks, Sonia, and thanks, David.
Thank you all for your lovely comments. So I'll just give it another minute or two if anyone else has any questions. Well, we'll just wait. I'll just set, you know, our contact details are there. So Orit and Ruth are still practicing in. Orit, are you still practicing in person, or are you?
So unless there is a need, then I do most of my consultations virtually, so online. If there is a need for a face-to-face, I would do one, but it's mostly online at the moment, unless there's a physical examination needed. Yeah.
Yeah, wonderful. So yeah, you can find Orit at the Longevity Lab for Functional Medicine Consults, and she also works with the Compass Lifestyle Clinics as a cannabis clinician.
And for functional medicine as well.
Okay, cool. All right, awesome. And Ruth is still practicing. So Ruth, you said you have Moxibustion at your clinic and you're still practicing at the moment?
Yep, I'm still practicing. Yeah, I'm open. Yep. And people can also just ring me if anyone has questions. You know, you're welcome to contact me. I'm open to. I love chatting about Chinese medicine. So yeah, I'm available.
Oh, lovely. You're both such wonderful sources of such a wealth of information. And my practice is in Springwood. My clinic is currently temporarily closed, but I'm doing online consults at the moment. And I've got a free immune boost e-course, which has another webinar with 3 free ebooks as well. It's available. I think the easiest way to find it at the moment is on my Facebook page. So if you go to my Facebook page, if you'd like to learn more about that. And yes, you can feel free to message or get in touch with me if any questions afterwards. So yes, I think that brings, I don't think there's any more questions. So that brings us to the end of our webinar. It was amazing. We had such a great turnout. We had 38 people here.
Everyone for joining us on your Saturday.
Yeah, thanks everyone. It's fantastic.
And thank you to Ruth
and happy to answer questions as well. If there are any more questions in the future, if you remember anything, then you can pop on my Facebook page. Is probably the best way. If you have any questions that are general, I guess, in nature.
Okay, beautiful. All right, so that's all. Have a beautiful day. Thank you, everyone.
Thank you.
The recording.
Thank you.
Bye.